Hi, this video of the Vertex hair restoration on an African American who has a very significant hair loss. He has a class 5 and he's thinning from the back all the way to the front. I'll go to put a minimum of 500 to 1,000 grafts in the back. If we can fill 500 to 1,000 in the back, he has good coverage. Now, he does not need as much as Asian or Caucasian hairline whose hair tend to be straighter. This African American has nice curly hair. So with that said, he will have better coverage, and that's a great thing about it. Plus he has dark skin with black hair. The contrast is less, and that will have better coverage. So he has a lot of factors that favor coverage for him. And so as I mentioned to other patient and other video, that there's a difference when we will restore the vertex hair versus the frontal hair, and that's the difference between the restoring vertex hair African versus Asian. Before we go further, I want you to go to my website at www.mhtaclinic.com 1-866-999-6482. Getting back to this patient, the diameter of his hair loss is around 5" by all the way toward the head. He has some there's some bridges here, but the bridge is breaking. The mid-scalp bridge hairs has been basically thinning out already, so it's more than 6 inch. So I'll go to put in as much hair in the back as we can too. But remember, as I mentioned, we're going to put at least the front first, 75%, whatever left we put in the back, because the front is where the money are. But the back, it's different hair transplant. The back, we use thicker roots, the root that go, that had 2, 3, or 4, so that had better coverage. The back angle is more steeper than the front, and the great thing is African American is the angle is not as important. Why? Because the hair is going to be curly no matter which angle I put. However, I still want to follow the natural pattern that the patient have. So then we don't have a problem with it. We don't have to worry so much about the colics because the hair curly, so then there's really not much of the colic to be worried about with storage. And as you know, I'm one of the few hair transplant surgeons who specialize in African American hair restoration. And if the surgeon does not have a lot of experience, there's many steps that can cause a very not great result. Number one, if you draw the hairline so high, that's not appropriate for African American, then it won't look great. Number two, during the process of harvesting the hair graft, there's high chance of damaging the roots if the angle is not perfect. Number three, due to the curly nature of the root and a very fragile African American hair root, if we don't know how to handle the root and pick it up in a certain angle and certain on the side and all the stuff, we can actually have high chance of damaging the root, which lead to a poor growth. So I have overcome many of these obstacles by using a special instrument to overcome the root handling. And then when we're placing the root too, we cannot just jam the root hair in straight in. We have to like glide it in a screw-like pattern, because if you jam it straight in like Asian, Caucasian, the root gonna crumble up. So as you can see, if you pay attention to a lot of meticulous detail, which I have been trying to do to ensure we have a better result, and that makes a big difference in hair restoration. And of course, the most important thing is experience. And I've done quite a few of African American hair patients from all around the country. And this patient, he's back in the Midwest. I can't tell you which state, but he's many states away from mine. So can I say Texas? Yeah, he's from Texas. See, I have a patient from New York. Yesterday I have a patient from Seattle. So patients from all around the country have flown in for me to do the hair transplant. I have patients going as far as from Dubai. But the most important thing is they have done research about me. They want to know and find out who really specialize in a certain field. And this is the Vertex hair restoration. Thank you.